The government has recently warned that the rate of COVID-19 vaccinations in the country is slowing down due to reduced demand. Many South Africans are saying lack of communication and misinformation on social media are some of the contributing factors to the slow vaccination rate, even as the fatality rate soars. This clearly indicates that more information and education about vaccines is needed. To help us understand more, we're joined by Immunisation Safety Expert, Professor Hannelie Meyer. Prof, good evening to you, and thank you so much for your time this evening. There's been a lot of concern around the slow uptake when it comes to the vaccination drive. A lot of people, some of them saying that they're not going simply because they are seeing varying concerns on social media. What needs to be done to ensure that those who are still hesitant or seeing information that's out there that might not be true, for them to go and get their shots?
Yes, indeed, it is a problem, and we have seen, quite a slowdown, as you say, and decrease in demand for vaccination. So fortunately now, when they open it up for the younger ones from 18 years upwards, we have seen in the past week quite an increase in the number of vaccinations, administered per day. But still, I absolutely agree. I think we need to, since the COVID-19 pandemic, the way in which the government has been communicating is really fantastic. So if you look at the SA coronavirus website, there's a lot of information and good, solid information available there. But are we reaching everybody? Are we reaching people from all walks of life? So there's a couple of questions that we need to ask in terms of how we are communicating with people, So how are we communicating? Are we making sure that our communication is reaching people of all literacy levels, for example? What about all languages that we are speaking in South Africa? So if we look at vaccines itself, it's a very complicated subject. So it's difficult for people to understand, even the highly literate, literate people, So you need critical thinking skills and so on to also understand, some of the complicated information. So are we making that available to people in a way that they can actually understand it? Also, you were talking about the safety of the vaccine. So what are we communicating? And I think we can do a lot more in terms of making sure that people are convinced that the vaccines are safe. Because if you look at all the surveys that we've had in the past, the number one reason that people are giving for being hesitant to vaccinate is always the safety concerns. And then together with that, as you are saying, all these myths and conspiracy theories and so on circulating on social media. So those things need to be debunked. And then the last...
Yes, Prof, continue.
So the last one also, which I think is very important, is to ask the question, with whom are we communicating? So we need to also make sure that we are communicating with all people from all walks of life. So we need to take the messages and the communication to the people. So we need to target certain groups. We've already seen that men are more reluctant to vaccinate compared to women. So what are we going to do about that? We need to find ways to reach them, like, for instance, the taxi drivers, or messages that would appeal to them. When we think of the youth, we need to use messages and ways of communication that would appeal to them. Use their kind of music, their kind of language, and so on. And then the elderly, or those who don't have access to technology or who can't work, maybe they don't have cell phones or they can't read them and so on. So we need to keep all of those things in mind, like radio and television. What kind of messages do we have? Regularly between each and every show, we can have messages to make sure it reaches everybody. And as I said, in all languages. So there's lots of ideas, I think, that we can actually use to make sure that our communication reaches everybody.
Now, Prof, we went to the streets and we spoke to some people just about their concerns and which questions they would like to be answered when it comes to concerns around the vaccines. And these ones really tie in with some of the safety concerns that you have raised. And I'd like us to listen to them and really just deliberate on them after this.
For me, it's a bit of a concern, because if I have underlying issues, does the vaccine then trigger underlying issues as much as COVID is triggering underlying issues?
In terms of taking the vaccines, there have been some news about some people getting sick like 2-3 days later after taking that. So we just wanted to find out, is that related to taking the shot, or is it just how different people react to it differently?
Would it have any effect on my hormones or, my menstrual cycle? Would I be infertile if I took it? Or would I still be able to get babies?
All right, Prof, I'd like us to begin with the first one. He's asking, does it trigger underlying conditions like COVID-19 does?
You know what? The problem is with COVID-19, what we should be worried more is, all the long-term effects of COVID-19. Like he said, does it trigger any other, conditions? So with COVID-19 itself, there's now lots of evidence available that people are really suffering from the long COVID, as we know. So high percentages of people, and also it continues for more than a year. On the other hand, with the vaccines, look, no vaccine is 100% safe or 100% effective. Now, with the COVID-19 vaccines, we've been using now, not we in South Africa, but looking at from it was rolled out in the US and the UK and so on. We've been using them now for about, say, 8 months. So we have a lot of data available on the safety of the vaccines. It's been used by billions of people by now. So the adverse events or effects that we are seeing with the vaccines are really the ones that we are expecting to see. So they are mild, they disappear within, maximum, say, 3 days, and, it's a normal reaction of your body. Then the rare events, so they are there, but as I said, they are very rare. So we do not expect to see them. So if we talk about rare events, we talk about events that we see in, say, 0.5 to about 10 or 8 people in a million. So as you can hear, it's very rare. And that's why we want people to report or anything of concern. So if you had your vaccine and you don't experience, the normal sore arm, headache, shivers, and so on, or it's continuing for more than 3 days, definitely you need to seek medical help, or anything, out of the ordinary that we do not expect. Because we need to make sure that we pick up anything of concern, and then people should seek medical help so that those things can be dealt with. And it's very important for people then to know where to report, and like, for instance, to go at a health facility, report there, or they can report on the Med Safety app, or they can phone the COVID-19 hotline. No other way of reporting, please. There are some fake websites that people are promoting, so people must please just use these ones that I mentioned now at the health facility, or the Med Safety app, or phone the COVID-19 hotline. But I mean, if we look at how many doses have been already used throughout the world, and with all vaccines, the long-term effects, you would see them within the first, say, 2 to 3 months. And we are not expecting to see anything, very, very serious or out of the ordinary now that we have already been using them for 8 months.
Now,
apart from those that's been identified, yes.
Now, Prof, the other one was also talking about, some people getting sick, and I'm sure he's referring to some of these rare cases that you are talking about. Is this because of the vaccine, or because people react differently to the vaccines?
Yes, so people do react differently to the vaccine. So if I'm talking about a rare event, I mean, it's very, very rare. No? So you won't see it in each and every second or 10th person, for example. So, and then what people must also remember, so now we are vaccinating millions of people. We've now vaccinated, say, nearly 12 million people in South Africa. So there are things happening on a daily basis. So people do get sick. People, so life is continuing. So a lot of things happen coincidentally also to the vaccines. It's just, a coincidence that it happens now on the day that you got the vaccine. So those things also need to be kept in mind. And this is especially important when it comes to death after vaccination. So there's been a lot of, news and discussions about the deaths that's been reported. But we want those to be reported so that we can do a causality assessment to determine, was it because of the vaccine or was it because of something else? And then also people with comorbidities, they are at a higher risk of, in the first place, of COVID-19 severe disease, should they get the virus, but then also, because of age and because of their comorbidities, they are just at a higher risk in any case of, developing various kinds of conditions, or even dying and so forth. So yes, it is. So also like you asked, people, they react differently. So younger people tend to, because their immune systems are still very, reactive. So some of them would have a more intense side effects or adverse effects after the vaccination. When it comes to our, the older age groups, they very often, their adverse effects are much more sort of milder. They go away quickly and so on. So it all depends on a person. Your immune system would actually determine how you are going to react. But it's a good sign because it shows your body is now, developing immunity and getting ready for should you then contract the virus.
Let's continue then our conversation with Professor Meyer. Professor, one of the viewers asked, would it have any effect on her hormones or menstrual cycle, or will it make her infertile at some stage?
Yes, I'm so glad she asked that question, because that's really one of the myths going around. And the answer is absolutely no. There's absolutely no evidence that the vaccine will have any effect on your hormones, on your infertility for males as well as for females. So in fact, women who are pregnant are at a much higher risk, when they get COVID-19 for severe disease and hospitalization. So, there's been some data out now on recommendations that women who are pregnant should be vaccinated once they've completed 14 weeks of their pregnancy. And they are recommending that all, women who are planning to fall pregnant or who are, planning to fall pregnant in the future, all should get vaccinated. So in the beginning, unfortunately, this high priority group was not included in the clinical trials just because of that's the way clinical trials work. They don't include high risk populations. So that's why, not a lot of data was available. But since they've started using the vaccines, automatically, people would be, go for vaccination, even part of the trials, not knowing that they are pregnant, for example. So they've been following these pregnant women, and there's absolutely no data that shows it could harm the pregnant lady or the child. In fact, it provides all the benefits, and as well as for breastfeeding. So please don't stop breastfeeding, continue with breastfeeding. And there are now studies also going on, small studies, but there's already evidence that the antibodies is passed through the breast milk as well as the placenta. So, they still need to confirm exactly, what effect does it have, in terms of benefits for the baby. But yes, so absolutely they should get vaccinated.
Okay, let's listen to some more viewer questions and take them and really just tackle them after this.
Okay, what are the long-term effects of the vaccine? Like, am I going to be allowed to donate blood and all of that? Like, yeah, like I feel like there's not enough information with regards to all of that. So yeah, we would like to know what is the long-term effects of the vaccine.
The research that has been done for this vaccine, I feel like it was too rushed. So I'm really not sure if this vaccine has been tested enough. So that's what I want to know, how extensive has this vaccine been tested? Because I have had cases of people that had negative adverse effects from the vaccine. So now the question is, will we be safe with this vaccine?
I'd like to know whether is it wrong to actually consume alcohol after you're vaccinated? Because a lot of young people, we like to be socialite, we like to go out, have alcohol, drink, especially over the weekend. So I'd like to know, if you are vaccinated, what effects does it have to one if you are vaccinated and then you consume alcohol? I think a lot of young people would like to know that question, really.
Prof, that last question, we've really been getting it a lot, especially after you've gotten vaccinated. They say to you, no alcohol consumption, and they give you then a bit of, the time in which you can't consume alcohol. Some have said, in fact, to us, 3 days. Let's talk about the adverse effects of alcohol and what it does to the body, because he says that they are socialites and they would like to consume alcohol on a weekend.
There's no data to show that, it has a negative effect on the vaccine and so on. The only thing that can actually happen, if you are going to have maybe 1 drink or 2 drinks, I really don't think it's going to make a huge difference. The only thing is, your adverse effects or your side effects, they would normally start around 6 hours after vaccination, 4 to 6 hours. It all depends on a person. Like I said, your immune system will determine how you will actually react. So now, what adverse effects are we seeing? Headache, body ache, shivers, a sore arm, people feeling tired, not feeling well. So now, if you consume a lot of alcohol, what effects do you get from alcohol? You also get those kind of effects. So it will just, worsen the whole situation, can I say. So now, if you do wake up the next day with this terrible headache, feeling horrible, and so on, because you had consumed a lot of alcohol the previous night. So is it now because of the vaccine, or is it because of the alcohol? So that's actually the easiest way to explain this. But, they recommend that once you had the vaccine, stay calm, don't do a lot of things, rest, drink a lot of water, and so on and so on. If you have experienced a headache or body aches, take some paracetamol. But I wouldn't say, you're not allowed to take any alcohol, because there's no evidence that, it will have a negative effect on your immune response. It could just, like I said, to do with all these adverse effects that you might experience.
And one of the viewers says that they'd like to know, what could the long-term effects be here after taking the vaccine? Can they still donate blood as well?
Yeah, absolutely. So that's not a problem at all. Like I said, we have already have a lot of data since the vaccines have been used across the globe. Actually, we have more safety data than for any other vaccine because so many people have already been vaccinated. And with all other vaccines, I mean, any long-term effects, usually you would see all the effects within the first, say, 6 weeks to maximum 3 months. So we are not expecting to see any serious long-term effects apart from what they have already seen. Like I said, I mean, there is a possibility of very rare effects, but they are indeed very rare. So you need to weigh up what is your chances of getting COVID-19. If you do, what are your chances of developing severe disease or having all these horrible long-term effects that we don't know how long they are going to last and how to manage them. So it's those things that you need to weigh against, up against one another.
And I've heard this quite a few times from a number of people who are saying the research that was done, they feel like it's been too rushed. And one of the viewers tonight, explaining that this, research may have been rushed, and he wants to know how extensive was this research?
In the first place, I mean, this is a coronavirus, so it's not a completely new virus. So there's already been a lot of research done on coronaviruses to start off with. Then also the new platforms, which everybody is talking about, is concerned about, the mRNA, the messenger RNA platform. So those also, although they were new, there has been some developments already taken place for a long period. So when they then identified the virus, they then started with working on the vaccine. So, I mean, for the whole of 2020, research has been going on in the development of the vaccines. I mean, there's still many candidates in the pipeline that they are working on, and even different dosage forms like nasal and so on and so on. So, and all vaccines that's been authorized have gone through all phases of a clinical trial. So you get phase 1, phase 2, phase 3. So in your phase 3 trial, you are testing the vaccine amongst a larger group of volunteers. So just to give you an idea, for the 2 vaccines we're using in South Africa, the J&J and the Pfizer vaccine, for each one of them, there were more than 43,000 volunteers in the clinical trial phase 3 studies. So only after that, when all the data was reviewed, these vaccines were authorized. So also to just, in terms of what the viewer asked, or the listener viewer, in terms of the length of the study or the research that's been going on. So to speed up the process, some of these phases, because it happens in phases and stages, they happened in parallel. So they were testing different things at the same time. Also, the manufacturing has been scaled up at a much earlier stage compared to other vaccines because it was a pandemic. So a lot of money, donations went into all of this so that they could start manufacturing while still busy with, say, phase 3. So by the time the data was available, they could make the vaccines available.
Now, Prof, as a final question, we saw research coming out saying that the Pfizer jab is 88% effective at preventing the infection and all of that, and we're also seeing the efficacy of other vaccines. But the worrying thing here is that they say after 5 to 6 months, the protection decreases to some kind of percentages to around 74%, for other vaccines falling by 14%. And this is a study by the Zoe COVID study. And a lot of people have said, if you then see studies that are telling you that the level of protection is going down, what would be the point then of getting vaccinated if I am to, again, find myself less protected in about 5 to 6 months?
Yeah, it is true that we have seen, like you mentioned, the study that the, the protection or your immunity is waning with time. So, I mean, this is not the first vaccine where we are seeing that. So, like, for example, most of the children vaccines, you need more than 1 dose. Some of them you need 4 doses. I mean, with your tetanus vaccine, you need a booster dose every 10 years. With your influenza vaccine, you need your influenza vaccine every year. So it's not new. But the thing is, we shouldn't say, well, now I don't need a vaccine, because it's all about stopping the spread of the virus. So the more people who are vaccinated, the fewer the opportunities, or the fewer the number of people who are susceptible to also get infected. And if you can stop the circulation of the virus, you can also stop the virus from now changing and mutating and making new variants. So already in the US, they have recommended that people who had the second Pfizer shot 8 months ago will be in line for a 3rd dose. With the J&J vaccine, the data is still showing that you still have protection for about 6 to 8 months, I think. But there's already some studies also ongoing for the J&J vaccine. So I anticipate that, yes, we will have to get booster doses in the future. But when is the other question. At least still at the moment, the vaccines are still providing good protection against severe disease and hospitalization. So it's more, for mild and moderate disease. But still, at least it's still providing good protection against severe disease and hospitalization. And for South Africa, we need to consider, we have only vaccinated a very small proportion of our population. So will it be fair to start giving booster doses while there are so many people who haven't had even 1 shot? But saying that, people need to come forward and get vaccinated, because at the moment we have the vaccines available. People must come and get the shots into their arms. That's what must happen now.
Prof, I'd like to thank you so much for your time. I know we took more time than we had requested earlier on, but thank you so much. We do appreciate those insights. That was Professor Hannelie Meyer. She's an immunization safety expert. I'm sure a lot of questions have been answered tonight, as Prof was really just taking us through some of the viewer questions who were just trying to get their heads around the vaccine and the questions that they have thereof. And in just